is an explanation on how we are implementing the xShareYellow button for the IPS in Madeira, xShareYellow. In brief, the architecture that is being developed assumes that the core EHR systems that exist are named Atrium systems. They have an intermediate asynchronous replica cache that is periodically refreshed with data available to query FHIR objects. This data is made available to a FHIR IPS translation server that is being implemented in Python, which contains the model classes of the original Atrium objects, a translation layer to model into FHIR, and then uses Jinja templates to generate the final JSON in the shape of the correct FHIR objects. This is then provided back as an IPS report. We are now seeing the implementation that so far shows the different submodules containing the schemas of the source objects on Atrium that have been exposed for transformation, which are implemented using SQL Alchemy mapped table objects, which are then passed through the Atrium to FHIR repository, which implementation allows the transformation into the bundles as requested for this time. We're gonna now see the generation of the IPS using the first persona. This is still running from client as the implementation is still being finalized and it's not yet put on the server. And we can see here the generation of the object, the JSON object, according to what is required for this phase. So the object has been rendered, containing the persona information, persona number 1, and now we're going to copy it into the validation front end. Applying the proper validator has been done in the and check that the implementation is valid. Though there are a lot of warnings because of the use of CPC codes that are native to the primary care coding system in Atrium. So this is the current implementation passing.
The xShareYellow button is an important step for the development of digital health in Madeira. Madeira has been focusing in Health 4.0 as a priority for several years and building a smart and connected healthcare system that allows the access to high quality, accurate and safe healthcare. This is important for enhancing patient care through interoperability and also data sharing. This project is also important because it gives the opportunity for portability of data in the European Union. Several steps have been already taken for the implementation of the xShareYellow button in Madeira. First, the team has identified the different digital health tools available in the region and have assessed it, evaluated it, taking into account not only the xShareYellow button framework, but also the European interoperability framework, such as the European Health Data Space regulations and also the International Patient Summary Standards. The absence of a patient summary in the patient health records at the moment was an obstacle, and the mapping of data was necessary to build up a patient summary that could be aligned with the international patient summary standards. All the mapping and the development was done using real-world data, the health data records in the regional health system, the public health system. And the work done aimed to make available this xShareYellow button through the app xShare, which is the app that allows patients to have access to their personal information regarding health. The xShareYellow button will be integrated in app xShare, which is, as I told you, a digital tool that allows users to have access to their medical information, their schedules, prescriptions, test results, and other health information that is available in the public health system. By integrating the xShareYellow button, the app xShare will allow users to have access, download, and share in a secure and easy way their personal health information through a standardized format, for example, the International Patient Summary. The xShareYellow button and its implementation is aligned with the European Health Data Space regulations. The xShareYellow button will allow the access to relevant healthcare information and guarantee interoperability between healthcare providers throughout Europe in a standardized way. This tool will allow an easy and secure health data sharing throughout Europe, allowing all the benefits of data sharing for patients and for providers and for the healthcare systems. The following steps are related to the alignment of the xShareYellow button with European health space requirements. It is important, it is critical to adopt common data formats, terminologies, and consent frameworks to ensure standardized and interoperable, machine and human-readable health data. Of course, there are several barriers to interoperability and data sharing. For example, the fragmentation in digital health systems, the variability in digital maturity of different regions and health systems too, and also the complex implementation of data protection regulations. Barriers also mean challenges, and we believe that a key challenge is to be able to engage and have the commitment of all stakeholders to this objective of data sharing across Europe.